Okay, and we are now live and recording. Madam Chair, take it away.
Thank you. Good morning, everyone. So happy to at least get to commune together in some way, even though it's not in person. So this is the meeting of the Texas Health Services Authority. It will now come to order. Ms. Neighbors, please take the roll call for attendance.
Gosh. Totally forgot. Sorry about that. Okay, Dr. Vital.
Hey, how you doing?
Hello.
Can you hear me? Hold on. Can you hear me?
Yes, we can hear you.
Okay.
Dr. Paula Anthony McMahon.
Here, hello.
Hello. Dr. Deshpande.
I'm here. Good morning, everyone.
Jonathan Sandstrom Hill. Emily Carter. Emily Hartman. Excuse me.
Here, good morning.
Dr. Bryant. Ms. Cuellar. Mr. James.
Here.
Ms. Rodriguez. Dr. Vital. I already said you, didn't I? Sorry about that.
Here.
Mr. Hukim.
I'm here. Good morning.
Good morning. Ms. Shahan. I think she just entered, so I know she's here. I'm juggling two things. And Mr. Green. And I think that's everybody. And I know, Ms. Shahan, you're here, right? I think.
Did you call
And
Shannon?
Dr. Liss is, Jerome Liss is here.
Oh, sorry about that, guys. I know.
Yes, I'm sorry.
Yeah,
This
yeah.
is Siobhan. I'm here too.
Okay, great. And Dr. Liss, you are here.
And obviously I'm here.
Oh, did I not call you? Obviously.
Okay. we're rusty at getting
All right,
back
guys, it's been a minute.
virtually. Yes, yes. So confirming that is a quorum, George?
Confirmed, we have quorum.
Wonderful. So with the quorum being present, I call this meeting of the Board of the Directors of the Texas Health Services Authority to order at 10:04 a.m. I'm Shannon Calhoun, Chair of the Board, and I would like to welcome board members and guests. As we start our work today, I always think it's helpful to review our stated purpose as described in the THSA's enabling statute. It's Chapter 182 of the Texas Health Services Health and Safety Code. THSA is established to promote, implement, and facilitate the voluntary and secure electronic exchange of health information. The THSA accomplishes this purpose through the HIE program, known as HIE Texas, and its privacy and security certification program, known as Secure Texas. As you're all aware, we're conducting today's meeting virtually. As shown in the meeting agenda, we will have items for the board to discuss, and we will also have time for public comment at the end of today's hearing. I would like to request the members of the public to hold their comments until either of those designated times. If you do wish to provide public comment today, please enter your name, your title, and your organization into the chat box, and then we will call upon you during the public comment period. Members, before we start today's meeting, we have some new staff members we would like for you to meet. The first is Wendy Whitaker, who is the THSA's new administrative assistant. Wendy, you can wave. Hi, Wendy.
Hey.
And of course, Catherine Lusk, the THSA's new Senior Director of Strategic Partnerships. Hello, Catherine.
Hi, everyone. So glad to be here.
We are happy to have you. Would you, Catherine, introduce yourself?
I certainly will. I'm Catherine Lusk, and as you know, I'm the new Strategic Partnerships Senior Director at THSA. I have a long line of experience, 30 plus years. I started out very young within the hospital industry, and I focused on interoperability. And so I believe I have a lot to offer to THSA in helping us move forward in that space. And I'm excited to be here.
We're happy to have you, Catherine. Wendy, would you introduce yourself, please?
Sure, I'm Wendy, and I, like you said, Shannon, I'm THSA's Executive Administrative Assistant, and I will just be here to take notes and help where needed.
Well, welcome, and we are happy to have you as well. Blessed with both of you. Okay, members, as our first item today, there's a presentation in our annual audit report by the authority's audit firm, which is Maxwell Lock and Ritter. It is available to review in attachment number 1, PDF page 2 in your attachments document. The board now calls Mrs. Alex Mahan of Maxwell Lock and Ritter.
All right. Thank you, Shannon.
You're welcome. Welcome for being here.
Yes, thank you for having us. So as mentioned, I'm Alex Mahan. I serve as the audit manager on your engagement team with Maxwell Lock and Ritter. We've served as your auditors for a number of years now. And with me is also AJ Zimmer-Hansel. He serves as our audit partner and one of the leaders of our nonprofit practice at MLR, and he'll be signing the audit opinion once approved and you all are ready to finalize. I'm going to walk through the attachment that Shannon just referenced, starting on page 3, if you all wanted to follow along. I did want to note that we met with the Finance Committee in January, and we talked through this document in quite a bit of detail and answered questions. So my main goal is to hit highlights today, and then of course, AJ or I would be happy to answer any additional questions. And please feel free to jump in and stop me as well as I go through. So if you start on page 3, this is the financial statements as of and for the year ended September 30th, and our independent auditors report, which starts on the page following, a couple pages following the table of contents. So starting on page 6. So we have audited these financial statements as of September 30th, 2020, and the related footnotes. Management is responsible for the preparation and fair presentation of these financials in accordance with generally accepted accounting principles. And our responsibility is to express an opinion as to whether, and give reasonable assurance as to whether the financials are free from material misstatement. And if you look at the middle of page 7, you can see that's where our audit opinion is stated. We are issuing a clean opinion, or we refer to it also as an unmodified opinion, that we have found your financial statements to be stated materially correctly for September 30th, 2020. And that is, as you know, the best level of assurance that you can receive. So we're happy to be presenting a clean audit, especially at the end of such an unusual year. And the next page after that just notes there is another report that accompanies this, and I'll point that out further when we get to page 17 of the drafts. But this is our consideration of THSA's internal control over financial reporting and on our tests of compliance with certain provisions, laws, and regulations. And you'll also notice that the date here is highlighted, and this is still in draft form, and that's just for your approval once you're all ready to finalize. So the pages that follow the opinion are management's discussion and analysis. Those start on page 10. They provide an overview of THSA's financial performance and financial activities for the year ended September 30th. A couple of highlights just noting here, I think the biggest difference if comparing to prior year is obviously the significant increase in revenue, which was driving an increase in expenses and corresponding increase in receivables, all related to that activity now underway under the new THSA contract under the IAPD that the organization is operating under. So significant increase in assets of about $2 million related to receivables under that agreement, corresponding increases in vendor obligations, so accounts payable to pay for contractual obligations for HIE technology work being done. So some of those highlights are pointed out here on page 10. And if you skip to the next few pages, pages 11 and 12 will show you that side-by-side comparison with some additional details. You can see how the performance of the organization changed year over year compared to 2019. In particular, if you're looking at page 12, you can see the $2.8 million increase in connectivity services revenue, and then a bit of a detailed breakdown in increases in spending. Predominantly, you'll see that contractors line item with a corresponding increase. And if you skip to page 15, this starts the face of the basic financials themselves, which are just presented as of the end of fiscal year 2020. Total assets of $3.5 million, the majority of which was due in receivables from the HHSC. You can see your vendor accounts payable there, and your net position of unrestricted net assets of $2.8 million. Statement of revenues, expenses, and changes in net position follows on page 16, reiterating much of that information in the MD&A. But what I wanted to point out on page 17 is your statement of cash flows. If you're looking at this, you'll see there was a negative number for cash used in operating activities during the year. But really, if you look at that bottom section, you can see that's really being driven by that increase in accounts receivable that was due and outstanding from the HHSC as of year end. So I'll continue on. If there aren't any questions, feel free to jump in. The following pages, starting on page 18, are the footnotes. These accompany the financial statements. And I'm just going to skim through these and hit a few highlights, not going to walk through all of them in detail. Management has provided us all of the information here in the first footnote in the organization description. If you look at page 19, this starts your summary of significant accounting policies. So this details all of the significant accounting policies that have an impact on the financial statements and provide a bit of detail. Really no significant changes there in accounting policies, but wanted to note on page 21 towards the top, there is a new lease standard that has not been implemented yet. It's still a few years off. What that lease standard boils down to is that lease commitments would be presented on the statement of financial position, reflected as a commitment liability with an offsetting right of use asset. But as I mentioned, that is a few years off and has already been delayed 2 or 3 times. So we will work with management when the appropriate time comes to implement that, and are always here to answer questions, and we'll certainly be providing future trainings as the date gets closer to require that adoption of that standard. But wanted to point that out on this page. And then footnote 3 here, you'll see concentrations of credit risk. Obviously, this is here as 100% of revenues and 100% of accounts receivable outstanding as of year end for due receivable under that HHSC contract. And wanted to note on the following page, which is page 22, footnote 5, some information here about commitments and contingencies. The main commitment, as I mentioned, related to leases. This is how leases are currently presented in financials under current guidance. You can see your future minimum lease payments here. And obviously wanted to note that COVID-19, the ongoing pandemic, is also pointed out here as a contingent situation given the uncertainty around the severity and duration. But at this time and throughout 2020, THSA has been actively managing operations to maintain cash flow, and management believes that THSA has adequate liquidity. But that is a disclosure that is going in all reports at this point. And then on the next page, these are the last few footnotes. Just wanted to point out footnote 8 lets you know that we are not aware, management has not made us aware of any subsequent events that would require an adjustment to these financials or a disclosure in the financials. And we'll obviously assert to that, since we've gone a few months past when you're expecting to issue these, the report, obviously management should let us know if there's been any changes there before we issue final. And then the last few pages that I mentioned, this is our independent auditor's report on internal control over financial reporting and compliance with other matters based on an audit of financial statements performed in accordance with government auditing standards. And this report, these few pages let you know that in planning and performing our audit, we did consider THSA's internal control over financial reporting as a basis for designing our procedures, not for the purpose of expressing an opinion. But if you look at the next page, page 26, while not providing an opinion on internal controls, we are pleased to note that we did not identify any deficiencies in internal control that would be considered, that we would consider a material weakness If we had, we would bring those to the board's attention. And then as also part of our audit, we perform tests of compliance in certain provisions of laws and regulations. And the results of our test did not disclose any instances of non-compliance that would be required to be reported under government auditing standards, which would also be something we would report. And I know that that takes me to the end of the financial statements. I know that George, you did not attach here our letter, our annual governance letter, which is fine. I just thought I'd hit a couple of high points from that letter as well, just to reiterate. That's a 3-page letter we issue every year as part of our audit, just provides a summary of our audit results. And the main highlights there for this year is that there were no new accounting policies adopted, no changes in accounting policies in 2020. But I think the best part of that letter is where we say we did not encounter any difficulties in working with management and the team. No, we did not have any disagreements with management in terms of accounting practices or policies, nothing like that. And also there were no audit adjustments recorded during the course of our audit, which is a testament to management being very well prepared for us to come in and perform a smooth audit. And especially this year, getting through it remotely, it all went very smoothly from our perspective. So just wanted to compliment management on that and thank you for being prepared. And the very last item, just to note there, is that there will be a management representation letter, which we'll need to have signed. That's standard every year, just lets us know that everything provided to us was complete and truthful and accurate. And once we have that signed, once you've approved the report, we can issue it final. So I went through those items pretty quickly and would be happy to answer questions.
Thank you, Alex. We appreciate your work on this. Members, our next item is to approve the audit report as laid out before the board. George, in absence of Jonathan, the treasurer, from being here, would you like to make comment?
First and foremost, thank you very much for that presentation, Alex. And thank you, Alex and AJ and Sherry and everyone else at Maxwell Lockenritter. As always, it's an absolute pleasure working with you all. We appreciate the hard work and the nice things said about management preparation. You guys always make it very easy. We greatly appreciate that and look forward to working with you next year as well.
Great, thank you, George.
Yep.
Thank you.
Is there any discussion?
Well, if there's no discussion, I'll move to approve the audit reports.
This is Paula, second.
Thank you so much. Please type those in the chat box if you don't mind. I'm sure we captured the first and second. Both the motion has been made and seconded, but now those in favor, please type aye in the chat box.
I meant to say a verbal aye because I'm driving.
That's fine. Great. We appreciate it. Thank you. And any opposed, also post in the chat box. And give us just a few minutes to assess the response. George?
Madam Chair, I'm seeing all ayes and no nays.
Excellent. The motion passes. We appreciate you guys participating in that action. Members, our next item is to approve the minutes for November 13th. Yes, it's been that long since we've met. And thank you, Alex. We appreciate you being here.
Thank you very much. We'll step off. Have a good rest of your meeting.
You too. Have a great weekend.
Bye-bye.
Yes, it has been since November 13th since we've met. So we need to check those minutes, please, which are available in attachment 2, PDF page 27 in your attachments document. Are there any discussions? Is there a motion to approve the minutes laid out before the board? If so, please type so moved in the chat box. And if you do, go ahead and say it verbally for those that are driving.
So moved.
Thank you.
Second.
And second, thank you. The motion has been made and seconded. Those in favor, please type aye in the chat box. And if you're not able, go ahead and say aye. Those opposed?
Aye.
Thank you. George, can you verify?
Madam Chair, I'm seeing all ayes and no nays in the chat box.
Excellent. Thank you all. The motion passes. Members, our next item is to approve the minutes of the January 28, 2021 Finance Committee meeting, which will be available for review in attachment number 3, PDF 31 in your attachments document. Is there any discussion? If there is a motion to approve the minutes laid out before the board, please, if so, type so moved in the chat box and say as well.
So moved.
Second,
Second.
Mr. Shpanda.
Thank you so much. There's been a second and a motion. If there's all those in favor, please type aye in the chat box or speak.
Aye.
Thank you. And any opposed? George, can you confirm?
Madam Chair, I'm seeing all ayes and no nays in the chat box.
Thank you. The motion passes. And members, our next item is the consideration and approval of THSA's financial statements through December 31st, 2020. The financial statements are available as attachment number 4, PDF page 34 in your attachments document. George, would you mind in the treasurer's absence that you give a brief financial statement report?
Yes. Thank you, Madam Chair. Members, if you'll turn to attachment number 4, PDF page 34 in your attachments documents, you'll see we have the fiscal year 2021 Q1 financial statements. Please note that today being April 2nd, we are technically 2 days past our second quarter of the financial year or the fiscal year. We'll go over that quarter at our May 14th board meeting. So if you'll turn to PDF page 35, you'll see on the statement of assets, liabilities, and net assets, THSA continues to maintain enough funds to fulfill its stated purpose under Chapter 182 of the Health and Safety Code. Please note that we do have a large amount of accounts receivable here. Again, this is because we conducted a large amount of work right before the end of the quarter, and we had submitted invoices but hadn't been paid at the time that these financial statements were put together. Please also note, however, that those invoices have all been submitted and paid on time as of today's date. If you'll turn to PDF page 36, you'll see that the THSA has a new category of revenues and expenses related to our STAR HIE Cooperative Agreements Program, the federal grants that we received from the Office of the National Coordinator for Health Information Technology. And please note that staff has also created a separate bank account to house these federal funds, as we do have additional restrictions with these funds that we do have separate and apart from our other operating funds. Somewhat of the ironic part is we used to have a separate bank account for such a purpose, and it had been quite some time since we had had federal funds, and we closed it out, I believe, 6 months before we were awarded this federal grant. So got to go through the process of opening that back up, but it's all for very good purpose. It's good to keep all of those funds very separated and firewalled. And then if you see on PDF page 37, the THSA continues to operate under budget in every category with just 2 exceptions. The first is a very small difference in the consultants line item. This was only over by a very small amount in the first quarter. We believe that that's already come back under budget by the end of this second quarter, and will continue to stay under budget for the rest of the year. The second exception is the STAR HIE grant line item. This was not included as a specific line item when we originally passed the budget, but it was accounted for in the overall budgets. We just didn't know how to specifically include it in detail The THSA also shows a healthy amount of revenues to offset any and all expenses, putting us in a good financial position through the first quarter of fiscal year 2021. And with that, I am happy to take any questions. Shannon, I believe you're on mute.
Thank you, Mr. Gooch. Are there any questions or discussion? Is there a motion to approve the financial statements as laid out before the board? If so, please type so moved and into the chat and also speak it. Thank you.
So moved, Deshpande.
Thank you.
Second.
Thank you. The motion has been made and seconded. Those in favor, please type aye in the chat box or speak if they need to. And those opposed,
Aye.
And Madam Chair, I'm seeing all ayes and no nays in the chat box.
Thank you, Mr. Gooch. The motion passes. Members, our next item is the consideration and approval of the THSA's annual report, which is available in attachment number 5, PDF page 38 in your attachments document. Mr. Gooch, could you please brief the members on this item?
Thank you, Madam Chair. As mentioned, this is the THSA's annual report. This is a report under Chapter 182 of the Health and Safety Code that we are required to submit to the legislature on an annual basis. And we've put this together, this report on PDF page 41. You'll see we'll have an executive summary of our activities over the year regarding development of the Eden platform, as well as the Pulse platform, and then utilizing that under the HHSC IAPD. We include other portions related to our STAR HIE grants, and this is based on calendar year. So there are some things that would be included in here because this calendar year goes to the end of December that would not be included in the report that we just heard, which is our audit report that actually ended September 30th. And the STAR HIE cooperative agreement would be one of those things because it came in literally on the very last day of the fiscal year, maybe first day of the next fiscal year, however you want to look at it. If you look at PDF page 42, we list a history and background of the Texas Health Services Authority, as well as its programs, HIE Texas and Secure Texas, beginning with our development in 2007, all the way up until present dates, which brings us to the middle of PDF page 43. And then if you'll see on PDF page 44, we list out the activities that we conducted during calendar year 2020. And a lot of this centers around our continued partnership with the Texas Health and Human Services Commission under the IAPD. And not only is this referenced as part of the IAPD, but that also includes the Texas Medicaid Health IT Strategic Plan. And that is really such a core component to highlight here, because that plan was passed as a condition of the state's extension of the 1115 waiver. CMS required that. And within that report, they do directly reference core components of Eden and Pulse and the Texas Health Services Authority's statewide infrastructure and partnership with local health information exchanges as well. And to reflect that, this board adopted an updated state health information exchange plan last year that does directly incorporate that Medicaid Health IT strategic plan into our state level health information exchange plan activities. So we definitely go over that as a core component of this report. And then on PDF pages 45 and 46, we also discuss our developments under Pulse, as well as the Saner project under the ONC STAR HIE Cooperative Agreement Program. And then we provide an analysis and conclusion on the last page of the report. And as soon as the board adopts this report, we'll make it available on the THSA's website in combination with the audit report that the board just approved earlier in the meeting today. And with that, I'm happy to take any questions.
Thank you, Mr. Gooch. Any discussion? With no discussion, is there a motion to approve the annual report as laid out before the board? If so, please type so moved and speak in, type in the chat box and speak.
So moved.
Thank you. There a second?
Second.
Thank you. The motion has been made and seconded. Those in favor, please type aye and speak that. And those opposed do the same.
Aye.
Madam Chair, I am seeing all ayes and no nays in the chat box.
Thank you, Mr. Gooch. The motion passes. Members, our next item today is an update from the THSA's CEO, George Gooch, on the Health Information Exchange Services. Mr. Gooch, could you please brief the members on this item?
Thank you, Madam Chair. For this update, we'll be sticking to the material listed in the slides. So we'll start with the current update of our HIE Texas programs, and we'll begin with the Eden program, which is the Emergency Department Encounter Notification System. We continue to have a very healthy partnership with the Texas Health and Human Services Commission and their Medicaid program, as well as our local health information exchanges. We are building interfaces to local HIEs. All of those have been complete at this point. We have a state level infrastructure that is available to local health information exchanges and hospital systems for use by Texas Medicaid and managed care organizations. And that is live and now in production. This establishes a basic push functionality of the HIE Texas infrastructure to send data, including admission, discharge, and transfer feeds, known as ADT feeds. And we also utilize that infrastructure to be able to both push and pull for CCDs, CDAs, clinical documents for compliance under this HIE connectivity project. I guess another major milestone that occurred just this week after we put together these materials is local health information exchanges. They separately contract with Texas Medicaid, and they're required to develop an interface with us, send certain data to Medicaid via this HIE Texas platform, and they have to send data for a certain period of time, and based on the timing before they can get fully reimbursed at the end of that timeline. And based on those timelines, local HIEs had to have all of the facilities that they were signing up to participate in this program complete and to us by March 31, 2021. So we did have a very large flurry of activity in increased number of facilities that are sending data via these local health information exchanges. And we're still going through all of that and sorting facilities, because there was obviously a lot of activity that also took place on March 31st itself. So we had a pretty rapid increase in the number of facilities sending data through the Eden system. We'd like to have statistics on that, but we're still tabulating all of that, and we'll send a communication out about that in the near future. So we are adding additional capacity for increased number of connections. This is a statewide platform, and it's a network of networks that we do in partnership with the entities that we just described. Separate and apart from any state programs that we just referenced, there is also a federal CMS e-notification condition of participation that is a huge driver for Eden and similar programs. that does require hospitals to share these ADT feeds as a condition of their participation in Medicare. And they must make a reasonable effort to be able to share this data with various healthcare professionals and the physicians that their patients see within the healthcare continuum. So the good news is that Eden is very specifically a tool that helps accomplish this condition of participation. And I really do want to give kudos to our state Medicaid program, because this is a program that's been in the works for quite some time. So that just really bolsters that they saw the value in what sharing this data, particularly at the scale of a state like Texas can do. And now that's really embedded in federal regulation as well. So that's a major driver. I think that we've seen a lot of interest from hospitals who are looking to comply with that regulation. So we imagine that there's going to be quite an uptick in participation during 2021 as well.
George, I had a quick question. What do you think is your biggest challenge or headwind that you're facing to improve adoption or get to the to the level of adoption that we're looking for Eden?
Right. So the level of adoption that we're looking for under the Eden program, because we do have on both the entities who send data and entities who receive data, and or both, we've got healthcare providers, we've got Medicaid providers, hospitals, we've got local health information exchanges, we have Medicaid as a program, and we have Medicaid MCOs as well. So the goal for us is to get 100% participation in every single category across the board. So I think what has been a challenge in the past is there are a number of solutions out there for all of these entities, a number of vendors, a number of ways to exchange data. But I really think that one of the big things that is going to be very central moving forward is this Medicaid Health IT strategic plan that we mentioned in the past. It's going to be something that I believe will be built off of into the future, and it's going to create this data ecosystem that I think is going to be very beneficial, not only for data, the entity sending data, receiving data, and the patients they serve, but our HIE infrastructure in the state at the state and local level. So I think that's been a challenge, but I think that now we're formulating plans to get all parties involved is something that's going to be a big driver for that.
Thank you.
Thank you. And then our next update is our update on our HIE Texas Pulse system, or the Patient Unified Lookup System for emergencies. We have now gone live with the second version of that platform. The first version was referred to as Pulse COVID. The second and upgraded version is known as the Pulse Enterprise system. This deployment was completed on January 21 of 2021, ahead of schedule. So the good news is that we are fully ready at this point in time to deploy this system, and we are still several months in advance of the hurricane season, which formally begins on June 1. And I think the really good news is that we are prepared and we can scale up quickly in terms of the end users that we have accessing that system. And we'll get into that a little bit later, a few slides ahead. But some of the activities that we do need to do between now and hurricane season is offer training and drills, which we are in the process of doing with potential end users of the system, deploy additional connectivity, in which to do that, we are fully connected today to the national networks and frameworks such as eHealth Exchange, Commonwealth, and Care Equality. And that actually does get us direct connectivity to 2 of the state's local health information exchanges, BICS and THSA. But that does leave another 3 that we still very much would like to partner with for this program. So we conducted a meeting with them to discuss connectivity, and we're in the process of conducting follow-up meetings for those HIEs that are interested in connecting to the Pulse platform. So a little bit more work to do on the data source side, and then training up those end users of the Pulse system. And those are things that we're looking to do between now and the end of hurricane season, or the beginning of hurricane season. Also before the end of hurricane season, hopefully just very far in advance of the end of hurricane season. So just to go over for everyone, we have multiple use cases under Pulse. And the first is disaster response for treatment and alternate care sites. And again, this is best suited for situations when we have a declared disaster in the state. Patients are pushed out of the area that they normally receive care, and they find their way to an alternate care site that does not otherwise have access to electronic health information. So if they get, pushed out of the Houston area due to a hurricane and they find themselves in Dallas, if they're going to a hospital that's in Dallas already, Pulse would not be the solution for that. There's already very likely an EHR system in that hospital system that they are presenting to. This would be more like they're in a church or a football stadium, very alternate care site that otherwise would not have access to electronic health information. This gives the disaster response volunteers in those alternate care sites remote and secure access to electronic health information. So that at a very high level encompasses the first and foremost use case for Pulse. And the second use case is essentially what we're doing is we're taking that same infrastructure that we're talking about and utilizing that for public health professionals such as epidemiologists to be able to do case management and be able to identify their public health needs, utilizing those same national networks that we talked about before. But what we're doing here instead is we're switching out the end users of those disaster response volunteers in alternate care sites, replacing them with public health professionals at both the state and local level. And in terms of governance work that we've been doing, we do know that this is a relatively new system and concept across the nation. We're one of only a handful of early adopters of the Pulse system. Some of the other big states are California and Florida, and they both very much need it, particularly on the disaster response side of things. There are perpetual wildfires that occur in California. Florida takes quite a few more hurricanes than we do. So we do know that we really want to have proper governance when it comes to exchanging patients' electronic health information. We want to make sure that we're tackling issues such as data privacy and security, processes for activation and user identity verification and workflow, and identify any policy barriers to any of these issues. And I think really one of the big things that I would like to tackle out of this work group, and we've already had our first meeting, is properly identifying who is an appropriate end user of the Pulse system and properly identifying who is not. So we're really starting where we know it's very safe. We're looking to onboard medical professionals such as physicians and nurses and others that very typically are involved in a patient's care. But then, you go out from there and there are all sorts of other layers of healthcare professionals who are involved in a patient's care who may otherwise have access to electronic health information when treating a patient. We want to make sure that we capture all of that and include them in the potential pool of users who would be end users of the Pulse system so that we can do outreach to them. We can find ways to properly identity proof who they are. We can authenticate them and we can onboard them to the Pulse system so that when an emergency hits, there's not a lot of administrative work that they need to do, and they can be ready to go and they can have access to this tool that can really affect health outcomes during these disasters. And then our last update is an update on the STAR HIE cooperative agreement and the SANER pilot projects that we are working on under that cooperative agreement. So just as a reminder to everyone, September 30th of 2020, THSA was the primary awardee of the STAR HIE cooperative agreement from ONC. We partnered with both Audacious Inquiry and THSA as sub-awardees. And the purpose of the project as we presented it to ONC was to allow automated collection of situational awareness data, such as bed capacity and ventilator inventory, from Texas hospitals utilizing the FHIR data standard. I'm very happy to report that Chairwoman Calhoun and I were able to give a presentation on this at the ONC annual meeting earlier this week. It went very well. We got a lot of positive feedback from that. And other states are beginning to take interest in what we are doing here in Texas. And so really at the core of what we're talking about here in Texas, and there's very similar situations across all states during the COVID-19 pandemic, is that via executive order, hospitals are required to report this situational awareness data to our Texas Department of State Health Services. So given that this is a very new reporting endeavor, this reporting often ends up being manual. Whether that be electronic or utilizing pen and paper, it can take additional time. Hospitals can utilize one or more FTEs for the sole purpose of creating this reporting. So what we're looking to do is automate that system, and not only automate it, but make sure that we have a proper data standard around extraction of that data. And this is data that doesn't reside just in the EHR system, but in other systems within the hospital. So being able to extract that data automatically and report it to the appropriate authorities is really the end goal of this. It ends up, saving time and money for hospitals, and hopefully we're doing it in a way that's easily ingestible by our state and local public health departments as well. So specifically, that is the underlying core component of this cooperative agreement that as we have laid it out here in Texas. Other states are doing similar, but not the same programs. We have developed multiple advisory groups, one for policy and one for technical, to help advise us on this project. And as we'll talk about on future slides here, the project was recently expanded by ONC to include vaccination data as well. And we will get into more specifics, but it not only expanded the scope of the project, but it expanded the number of entities involved. Some of the next steps that we have is we've submitted a detailed project work plan to ONC regarding this additional component of the project. We have upcoming presentations potentially at HIMSS and the Public Health Preparedness Summit, and actually now this has already occurred in the past. We presented at Health Data Palooza.
Hey, George, are you collecting any of the manually delivered data right now or no?
No, we are not. And that's because this is a pilot and we're looking to partner with 1 to 2 hospitals to show that we can do this utilizing this data standard. And DSHS is working very closely with us on this so that hopefully we can get some lessons learned. Part of what we would really like, and the core goal of the cooperative agreement, is for public health and health information exchange to better utilize each other. But even at the end of this pilot project, if that's not what the end means of it is if we still get to a point where we're adopting a data standard as a state and the nation for automatic extraction and reporting of this data, that's still a win for everyone. In addition to that, there are a lot of benefits that the state can get from leveraging our network of networks infrastructure for reporting and bidirectional exchange of health and situational awareness data. But that's not something specifically we're doing right now, as this is pretty narrowly focused pilot project. Thank you.
George,
great question.
George, this is Lourdes Cuellar. In their partnerships, are you considering, my concern is vaccinations, are you considering community and retail pharmacies? Most people prefer to get their vaccinations in pharmacies nowadays, which is coming across in the statistics of the COVID vaccine versus a physician's office. They're
Right.
more accessible, and you know, and it can be everything from pneumococcal to, you know, I've recently got my shingles as well as my COVID, and that's becoming the place because they can give vaccinations to kids all the way down to 7. And so, because in the hospital setting, with the exception of maybe pediatric, you don't see too many vaccinations given.
Right. I'll tell you what, I'm going to address that in like probably just this very next slide.
Okay, perfect.
I'll more specifically go over what are the parameters of this extended portion of the cooperative agreement, but that is a very important factor, something that is being taken into consideration here in Texas, and we'll get into a little bit more detail. So in January of this year, the cooperative agreement was expanded to improve COVID-19 vaccination data by connecting immunization information systems here in Texas, that is MTRAC, which is maintained by our Department of State Health Services, to health information exchanges. This funding is being utilized to better align HIEs with public health and leverage extensive amount of clinical data held by health information exchanges to support enhanced knowledge sharing around COVID-19 vaccinations. So really the underlying point is for health information exchanges who are recipients of these grant funds to ingest data from their state IIS, which here would be MTRAC, combine that with the clinical data that they already have in their HIE system to be able to provide better insights into COVID-19 vaccine distribution and other issues associated with COVID-19, and specifically targeting that for vulnerable or at-risk populations in areas of the state that are hit the hardest by the COVID-19 pandemic. That being said, because it includes that specific set of activities, this is something that THSA is not directly permitted to participate in. We do have restrictions under Chapter 182 of the Texas Health and Safety Code that does not allow THSA to do both together the collection and analysis of clinical data. You know, sometimes it's like a question of like, is that clinical data? Is that analytics? This, I think no matter what way you describe this, you're both collecting and conducting analytics on clinical data, and there's just no way around that. So our way around that still was that THSA was not going to participate in those activities. However, we are partnering with THSA and Audacious Inquiry. So for this additional component of the cooperative agreement, THSA is just acting as the pass-through or fiscal agents of those funds for THSA and Audacious Inquiry to work together. So it would be THSA ingesting that data from MTRAC to combine it with THSA data to provide these insights of COVID-19 vaccine distribution and other issues associated with COVID-19 in areas that have been of the state that have been hit the hardest. That being said, on top of that, there are some additional challenges that we have. Chapter 161 of the Texas Health and Safety Code does have some very strict parameters around patient consent for even getting the data to MTRAC. And then once it's there, there are additional specific parameters around to whom that data can be disclosed to and for what purpose. So what we're finding is that that doesn't perfectly align the permitted disclosure purposes under Chapter 161 of the Health and Safety Code with the grant cooperative agreement program as described by ONC. So we are brainstorming on a number of ways to be able to either operate within the bounds of 161 pursuant to an exception, or whether there can be some exception to the cooperative agreement program. And some of those things are ideas such as not utilizing patient-specific data, but aggregate data instead. Or instead of the HIE ingesting the data, it would be MTRAC ingesting data from the HIE to conduct the same analytics, but there are no restrictions on DSHS receiving data from HIEs, but there are some restrictions on HIEs receiving data from MTRAC. So those are some of the specific challenges associated with the additional components of the program. I am going to end on a more positive note to say, when they did expand this program, it did capture 2 additional local health information exchanges that were not in the original group of 5 awardees. And those are Rio Grande Valley Health Information Exchange, as well as Greater Houston Health Connect. So we are all working collaboratively together with ONC and with the Department of State Health Services to figure out a path forward for this additional component of the grant.
Hey, George, this is very interesting, and I'm not totally sure I comprehend all of the individual challenges that you've just described. I feel like I need to see this or written on paper to make sure I'm understanding this. But I've got a couple of questions. Let me first ask, just with regard to this last bullet point that you're showing here, I want to make sure I'm understanding exactly what is the nature of the contribution or participation of THSA in this COVID-19 vaccination part of this. Like, I mean, I'm hearing you say, or at least I thought I heard you say, you're basically just passing money through to these other entities, but I'm also hearing from your description that there are obviously a lot of potentially legal issues that you're working through. Like, are we part of that conversation in conjunction with these people, or is that just conversation that's happening outside and you're telling us about it?
Very good questions. So first and foremost, usually those other entities that we're passing the money through, when we don't take any of it, they love that. This does mean more funding for THSA and Audacious Inquiry to work together on this. But no, our limitation is we are not participating in the part where we directly do anything with that data. We are still taking the program infrastructure, I'll say, that we've set up, and we're providing a venue to work through these issues with DSHS, with local HIE, with ONC, through our policy advisory groups, through our technical advisory group. So we're still leading this discussion, and we're figuring out a collaborative path forward. The thing that we're not taking any money for those activities, and we're not actually manipulating the data or doing anything in that regard. So yeah, we're being very conservative about that approach because we do not want to run afoul of our enabling statute, Chapter 182, let alone some of these additional restrictions that are present in Chapter 161 of the Health and Safety Code. So I do hope that provides some clarity. We do have a very limited role in the additional portions of the cooperative agreement.
Okay, but that's still an important role that we're playing just as a convener of the collaborative of stakeholders involved, right? So
right, very much. And we're really still picking up from a technical perspective what THSA and AI are doing together really does build on what we are doing under the SANER project with the situational awareness data. It is still trying to leverage a lot of those same technical data standards and infrastructure. But it's just THSA, we're not involved in it for this part. So
let me ask you a somewhat related question just with regard to that technical standard idea. And it's with respect to the incorporation of this immunization data into or making it accessible through the health information exchanges. Was that not already on some sort of roadmap prior to this particular opportunity? I mean, just a general question. With an understanding that there was this separate immunization related system out there, was that not already somewhere in somebody's consideration?
Yeah, so it's always, I mean, since the inception of THSA and since the development of the first state HIE plan in 2010, it's always been very recognized that one of the goals of health information exchange is to simplify the number of connections that we have crossing between the public and private sectors. even then in 2010 at the time, there are multiple registries within DSHS. There's cancer, communicable disease, MTRAC, among others. And you're building connections to each one of these. Since that time, they have simplified it by building a gateway that can connect in once and get many. But what's always been a core component of the state HIE plan and subsequent plans, both within just the public sector and within the HIE realm since then, is to connect in our network of networks model to where those in the private sector who need to send and receive data with DSHS registries, with Medicaid, with others, they can connect one time to both participate in health information exchange as well as conduct those data exchange activities with public sector entities as well. So it's always been part of the roadmap. It's just it's had various iterations over the years. It's been difficult to get going. One thing I'll say just very globally, without getting into any specifics, I think that we're seeing under the COVID-19 pandemic it is difficult for public health, to engage in some of these activities. Technology advances very rapidly, and they do have mechanisms of obtaining the data. But when it comes to engaging with health information exchanges, those things have not always necessarily been in alignment, and due to budgetary and FTE constraints, it's really hard to make that leap. So what we're really trying to do to work with them under this project and everything we do is try to meet them where they're at, and hopefully they can get more resources along the way too. But it's been an ongoing challenge, but it hasn't been for lack of trying on either side of the equation, I guess is what I'm trying to say.
That's helpful. Thank you, George.
Yeah.
George, quick question. Quite quick question.
Yes.
Related to that, since we're doing all of this, basically conducting and orchestrating, kind of like a drum major, is there any compensation that we will be able to get as an organization now in the future financially for doing all of this work, or are we just putting in, I guess, sweat equity investment with hopes of being able to become more of a financial participant in the future?
So I'll say because there are two components to this cooperative agreement: the underlying situational awareness data component, and then the supplemental vaccination data component. Under the underlying component of it, THSA, for project management and some of the activities that we were conducting technically under the project, we are getting reimbursed and compensated for that.
Okay, good.
For the add-on components, no, that is the drummer, that is the sweat equity. I'm definitely gonna incorporate those into a slide at a future board meeting. So yeah, those are things that we're doing, but it's really part of our mission of the THSA, to be able to help solve these components between the public and private sectors for interoperability. So we do think it's something that was very important to do. We knew that there were going to be challenges when we took it on, but we just decided that it's something we really wanted to tackle in a very collaborative manner with all of the stakeholders involved.
I agree.
Sorry.
I'm sorry. Go ahead.
No, go ahead. Sorry.
No, I was just saying that I just want to make sure if there is a line item, since this is a legislative section going on, if there's a line item where the budget needs to be increased to compensate for some of the stress that our infrastructure may be put under to do these projects, that may be something we may need to consider. That's all.
Thank you. Very great question. Great comment. And Dr. Lisk, is that who I heard in the background?
Yes. So basically, with the add-ons, we're just acting as an advisory role.
Right. We're not giving away health information exchange for free. Basically, just all the good ideas up here and time and efforts. So
just connecting them with the proper people, basically.
Right. We're acting as a venue to convene all of these stakeholders.
Yeah. Okay. Thank you.
Yeah. Thank you both. Great questions. So that concludes the health information exchange portions of the update. Let me make sure I'm not supposed to. But yeah, Shannon, I guess there is a pause here for you to. We do break it down by subsection in this update. But okay. Oh, and Shannon's internet just went down, so we're gonna keep going through this updates. So I guess with that, I am going to note, Emily, are you here and available with great internet?
I am here and available and hopefully with great internet.
Okay, great. We have our next item within this section is going to include an action item with a vote. So if we don't have Shannon back in time, would you be available to be able to conduct that vote as vice chair?
Of course. I see Shannon though.
Oh, good. Okay. All right. Well, I am gonna go through.
I'm here.
Oh, great. Hey, Shannon.
Sorry.
Okay. That's quite all right.
Yeah, for connectivity. Thank you, George, for that brief of all the activities happening under the HIE component of THSA. I just want to pause a minute and say congratulations to you and the staff. Number one, of course, this last year has been a unique period, but certainly we knew a year ago we were turning around, and that this activity has really proven the value of that turnaround. And I look forward to seeing this growth continue for us. So congratulations for that. Thank you all also for the comments. I encourage all of us to be engaged and understand what's happening. It's a new activity, but certainly what all we had hoped this organization would do. So with that, George has obviously mentioned he's moving on to the privacy and security services. So thank you, George. Would you please brief them?
Thank you, Madam Chair, for the handoff and the wonderful comments. So members, next is an update of our privacy and security services. As part of those services, we have a certification program called Secure Texas Health Information Privacy and Security Certification. We are charged with providing this voluntary certification for Texas-based covered entities, as that term is defined under the Texas Medical Records Privacy Act, to certify their past compliance with state and federal medical privacy and security laws. THSA accomplishes this through partnership with its preferred vendor organizations, of which are available on our website. So we did hear from some board members that there have been some interesting updates that have happened at the federal level. HR 7898 was signed into law on January 5th of this year, and it requires federal health and human services to incentivize cybersecurity best practices for meeting certain HIPAA requirements. And they do take these cybersecurity best practices into consideration when formulating the amounts of civil money penalties. So this sounds very strikingly similar to the structure that we have here at the state level. And essentially what it is that for our Texas Medical Records Privacy Act, entities who have our certification, who in effect have been showing that they are enabling some of these best practices in how they safeguard, use, and disclose sensitive and protected health information, they are entitled to present that certification as evidence, as a mitigating factor for potential violations of the Medical Records Privacy Act. So the question is how does that play in with what sounds like a very similar infrastructure at the federal level for cybersecurity best practices? So I will say that they are very complementary. At the federal level, they don't have any specific organization similar to THSA that would be certifying these entities, but they would incorporate that into, there are certain factors that OCR, the Office for Civil Rights under HHS, is already required to take into consideration when formulating the amount of civil money penalties, and that is the history of the covered entities past compliance with the administrative simplification rules, the privacy rule, the security rule, the breach notification rule. So they're tacking on cybersecurity best practices to that, and that really does add to some of the core components of HIPAA to incentivize good actors, you know, and only go after the actors who are not trying to do the right thing. And I think that this adds a carrot to that, in addition to some of the sticks that they've had in the past. So it is something that, in terms of our certification, we can make sure that we can continue to, because a lot of them are already considered embedded within the Secure Texas certification standards, make sure that we're aligning our cybersecurity certification standards with those that are taken under consideration in HIPAA. Because although we can't say to a covered entity here in Texas, if you have our certification, you get to mitigate your damages at the federal level, we can say that this is an objective third-party scorecard that you can turn into OCR to show them, hey, you know, I had a state-backed entity who conducted a certification. They included these same cybersecurity requirements that you are required to take in consideration when evaluating the amount of my civil money penalty, and I would like to submit this as evidence. So it's not going to be binding, but it is something that can bolster the value of Secure Texas certification as well. So that is our update on Secure Texas certification. However, another privacy and security update is we do have in your attachments document, attachment number 6, PDF page 48, a proposed policy and procedures for compliance with the recently implemented information blocking rule. One thing I do want to note for the board up front is that this is a pretty straightforward policy because the effective date of the information blocking rule is April 5th, which is right around the corner. It worked out very well that we have a board meeting today, April 2nd, so we can adopt a policy to show our compliance with this, but we should continue to refine our other privacy and security policies and procedures, because a lot of these overlap with, but are not the exact same as, our current privacy and security policies and procedures relating to protected health information for compliance with the HIPAA privacy and security rules and breach notification rules, as well as our state level privacy rules. This is information blocking, and it's really meant to take the HIPAA dynamic and kind of flip it on its head, which as a privacy professional, I'm very much in favor of, because in the past, HIPAA was a very long journey of an implementation across the nation, and it led to a lot of confusion. While it's supposed to act as a guideline for how covered entities such as healthcare providers, health plans, and healthcare clearinghouses can and should share protected health information as well as safeguarding it, it often acted as a barrier to share that information. An individual or other party who should be entitled to have access to the information arrives at a healthcare setting, asks for access to protected health information, and they're told, no, I can't give that to you because HIPAA. And with the infrastructure under HIPAA of permitted and required disclosures, those required disclosures are pretty narrow, whereas the permitted disclosures were more of the everyday exchange of the information and pretty broad. So what this does is it creates a definition of information blocking, and we're capturing that here in these policies and procedures. And the way I tell it to everyone is, if you are subject to this law, which we as a health information exchange or network are, someone asks you for access to their health information, you should assume, it doesn't necessarily mean that you are, you should assume upfront that you're likely in violation of that core rule, unless you meet one of the 8 exceptions to that rule. So again, they're really aligning that if you are not going to hand over health information, you better have a specific reason as to why you're not going to share it, as opposed to the previous example I shared before, which was, I can't share it because HIPAA. It's not a permitted purpose. So it changes the entire dynamic. So we've created this policy and procedure to comply with that. But again, we do need to go through our remaining privacy and security policies and procedures, overlay that, see how it interacts with those policies, and make amendments as necessary. But one thing we are making clear here is that until such time that we do, and we put this directly in the policy, until such time that these changes are made, and to the extent that this policy conflicts with any other THSA policies, this policy controls. We provide definitions on electronic access, electronic health information, information blocking, interoperability, and then we provide the procedures that really lay out what is information blocking, what are the exceptions to it, and what are the instances that we would disclose that electronic health information. With that, I am happy to take any questions in advance of the consideration by the board. Okay. And Shannon, are you still with us? Oh, there she is.
Maybe she switched devices, Mr. Gooch.
She has. She's Shannon's iPhone right now, but I get the feeling that there's a chance she can hear us and maybe we can't hear her. Shannon, would you prefer that we delay this vote until the end of the meeting while you address some technical difficulties? Maybe she can't hear us.
Oh, she typed in the chat, George.
Oh.
She said it's okay to go forward.
Okay. Should we have Emily run the vote? Or I can type that question back to her. Oh, and the answer is yes, please. Emily, do you know what to say?
I don't, but I can wing it if you'd like, or there's something.
We can do this like swearing in ceremony style, where I can read it and then you can repeat it. Does that sound good?
Oh, perfect.
Okay. So where do I, okay. All right, so first you can ask, is there any discussion?
Is there any discussion?
And now you can ask, is there a motion to approve the policy as laid out before the board? If so, please type so moved into the chat box.
Is there a motion to approve the policy that's been laid out to the board? If so, please type so moved into the chat box.
And I'll second. It's Dr. Deshpande.
Okay. In that case, Emily, now you can say the motion has been made and seconded.
The motion has been made and seconded.
And those in favor, please type aye into the chat box.
Those in favor, please type aye into the chat box.
And you can ask, are there any opposed?
Any opposed?
And Madam Vice Chair, I am looking in the chat and I see all ayes and no nays, in which case you may say that the motion passes.
Wonderful, motion passes. Thank you.
All right, thank you. Members, our next item is an update on the THSA Collaboration Council. The THSA Collaboration Council conducted their last meeting on January 26, 2021. The slides of this presentation are available for your review as attachment number 7, PDF page 48 in your attachments document. I do want to remind members that very similar to, we have a public-private infrastructure. The governor appoints this board of directors, which represents a public component of the infrastructure. And then on the private side of that equation, we have the Collaboration Council. That council represents entities across the healthcare continuum, very similar to the entities that you all represent as laid out in Chapter 182 of the Health and Safety Code. Under this Collaboration Council, we are setting up individual work groups, and that's where we set up the Pulse Governance Work Group. So it really adds on to our governance infrastructure to be able to have this work group convene in advance of these Collaboration Council meetings, report to that council, and then that council hears these updates and we provide a report of what was discussed back to the board of directors on a quarterly basis. So all of these things kind of roll up into each other. This council meets next on April 6th, 2021, which is actually a very small period of time between the board meeting and then, but again, this board meeting was originally scheduled for February, so which is why we have a somewhat short period of time in between. And that is my update on the Collaboration Council. I believe that Chairwoman Calhoun is back with us.
I am, and thank you so much for belaboring that with me. I apologize. Our next item on the agenda is that we will have a board meeting on May 14th, and it will be in a public administrative, our next meeting will be a public administrative hearing, May 14th. Do any of the members have any questions about the meeting schedule?
They're still going to be Zoom meetings?
Yes. Well, we'll have both, right?
Yeah, so the plan for the time being would be to have them as Zoom meetings. We are still under executive order that waives those Open Meetings Act requirements. The only caveat that I will add to that is that there have been a number of bills that have been filed during this legislative session that do address this issue under the Open Meetings Act. And the real one that keeps us all meeting in person is that you have to have a quorum in person, and then others can join remotely. Ironically, the reason in the past, before the pandemic, that we've always wanted a person to be able to meet remotely is we may be falling just short of a quorum when we need to reach it, and that wouldn't work in that scenario. So we'll continue to keep the board updated on the outcome of any of those and the plan for conducting meetings in person and or virtually for the future. I heavily imagine that the May 14th board meeting, though, that happens in just 6 weeks from now, that would be virtual.
Okay, because I was just wondering, I'm ready to come back to Austin.
I think we all are.
Yes, I'd like to see people in person rather than through a computer screen, but I understand.
We will as soon as we possibly can, and we'll keep everybody apprised of that. So appreciate your hopes. We share the same. What about any of the members? Do you have any items that you would like to be included on our next meeting agenda? And with that, and no comment, before we adjourn for the day, I would like to ask, is there anyone that would like to provide public comment at this time? Has anyone in the staff seen a chat comment requesting that?
Madam Chair, I have not seen anyone enter any requests for the public comment period today. Yes, I just confirmed.
Excellent. Well, I thank you all very much for a very productive meeting. Is there a motion to adjourn the meeting of the Board of Directors of the Texas Health Services Authority? And if so, please type so moved in the chat box.
So move.
Thank you, Dr. Vital. Is there a second?
Second.
Thank you so much. There's been a motion made and seconded. Those in favor, please type aye in the chat box or verbalize aye, and the same for those opposed.
Okay. Madam Chair, I am seeing all ayes and one thank you, and no nays in the chat box.
Wonderful. Thank you, Mr. Gooch. Though the motion passes and the meeting is adjourned now at 11:27 a.m. Thank you all.
Thanks, everyone. Thanks,
Look forward to
THSA.
talking with you next time.
Thank you.
Y'all be good. Happy Easter.
Bye, everybody. Stay
Happy
safe.
Easter.
Happy Easter.
Happy Easter.
God bless y'all.